This is the lateral pivot shift. This is for cruciate and rotary instability of the knee. The starting, as the patient is supine, the starting position for the test is complete extension with the foot internally rotated. I'm going to take my hand and put my fifth metacarpal right about the head of the fibula, right there. Okay, I've got to squat down a little bit unless I have a higher table. And what I'm going to do is I'm going to do a valgus stress test as well as an anterior translation of the tibia, okay, where I'm going to try to jut the, relax, you got to relax, okay. So I'm doing a valgus stress test and I'm pushing on the posterior side of the fibula, and what I'm looking for, positive test would be anterior translation of the tibia, and then rotation of the tibia, coming out while I'm pushing on the lateral side. When I return, I'm going to return very slowly, and if I get a positive test on the pivot shift as I return, the tibia will sublux and jerk back. That is called the Houston jerk test, and I'll let them return and it'll actually sublux and clunk back or jerk back. And that's called the Houston jerk test. Again, I'm here on the head of the fibula, just distal to the knee joint, internally rotating the foot. I'm providing a valgus force and trying to translate the tibia anteriorly to see if the tibia will pivot and shift anteriorly. And then as I allow gravity and the knee to normally come into extension, it will jerk back into place and sublux back into place for the Houston jerk test.